CDMO. This is a very interesting theme. I will come about what is CDMO. 23 stocks and generic exports 20 stocks. So if you add them, it's close to 125 stocks. And hence, first things first, ये narrow sector नहीं है, but broad sector है. So that is the first reason why we are considering a launch of a healthcare fund. So what are the opportunities in healthcare theme? There are 4 broad opportunities. First is there is a demographic shift. ये slide ना बहुत important है. You please remember this slide because I'll refer to this slide some slides later. The median age of India is now reaching 28 years. So India, earlier we used to always say, na, why is India a great place to, or why will India do well? Because we are a country of young people. We are now actually not a country of young people. We are now becoming a country of middle-aged people. Remember this number, 28.4, 30 years, muta-muti. Now when that, any country when it comes to this inflection point, the spend of healthcare zooms from then on. And there is a live example we'll show you. So there is a clear thing that as India is aging, the spends on healthcare will start exploding. So that's the first opportunity we are seeing. And this is the thing that as you see, healthcare spends which were 18%, 18 rupees of spend per capita. So every person was spending $18 of one's money on healthcare is already reached 90. But that 90 is still so small compared to the spend per person in these markets. So an average Chinese spends $700 on healthcare spends. Now you will say why suddenly thoda, what is happening to China? Is China more ill than India? No. And I'll give you the reasons why as the economy progresses, spends on healthcare will only start going up. It is a hugely under-penetrated market. Japan has for every 1,000 citizens, there are 12 beds. In India, there are only 1.3 beds. Yeah, Hyderabad might be different because Hyderabad, I think, has more hospitals than schools, more hospitals than even residential property. मुझे ढूंढना लगता है वो hospital दिख रहा है. Every street has some 10 jazzy hospitals which are up, and I'm sure Hyderabad must be benefiting from medical tourism because आप लोग तो नहीं जा रहे हो हर दिन ना, तो कोई तो जा रहा है. Either internally you are attracting people from other parts of the country, or you are attracting global clients who come and do medical tourism here. This is very important slide. See, 20 years back, and many of you might be selling financial products, awareness of insurance was limited to life. Even Prudent, when did it start selling health and general? Last 4-5 years. Earlier, and even life to abhi shuru kiya na, Prudent was only mutual funds. Now what that does is, insurance cover today is around 37, 55% is likely to in the next 5 years go to 70%. Now what is the ripple effect of that? 10 साल पहले और 5 साल पहले, how many of you have health insurance firstly? All of you have, or all of you would have? So today, the moment anything happens, do you go to the government hospital or to a public private hospital? Many of you would not have seen the government also. If I ask my daughter who is in Bombay, take me to the nearest government hospital, she will know government ka hospital bhi hota hai, she will ask me. Because we all also for doing a vaccination, we want Netflix. Otherwise, wo injection maza nahi aata hai na. Why is that happening? Because earlier if you were spending 100 rupees, everything used to come from our pocket. So you wanted to find the cheapest one. Today, when insurance is paying for you, वो भी cashless, how does it matter if it is 1,000 rupees here? And what that does is, over the years, if 2022 you were spending 100 rupees, 50 was coming from your pocket and 50 from insurance, over the next 5 years, 65% will come from your pocket, from insurance pocket, and only 35 you will have to bear. And hence your willingness to spend for high quality healthcare will only increase. That's why you see more healthcare hospitals today are better equipped than even hotels. 5-star hotels have unka rooms better. And some of the rooms charge 15, 20, 25,000. Occasionally when there's a World Cup final, they charge 50,000. You heard that story, na? You don't know that story? Ahmedabad, India, Pakistan match, people went and got admitted to hospitals for 2 nights because the hotel rate was 1 lakh, hospital में 30,000 में bed मिल रहा था. You don't know. The actual thing happened, sir. Big opportunity is medical tourism. This is a fantastic opportunity. Medical tourism industry 2024 में $42 billion है. Expected to go 3 times in the next 5 years. And why will India be the big attractor? Look at the cost of any medical surgery in India versus to the rest of the world. Forget US or Korea. Look at even a developing country like Costa Rica. People are saying I'd rather come to India and do my angioplasty at 3,000 rupees dollars, and the remaining 10,000 I will do some tourism also. मैं India आया हूँ तो थोड़ा ताजमहल, चारमीनार देख के भी जाता हूँ. And that is the money you save versus that country, and this will attract, already attracting massive amounts of people. So Calcutta, if you go, attracts thousands of patients from Bangladesh. As any one of you gone to Apollo Hospital, Chennai? And exports, clearly India is a leading player, and as the world population starts going up, people will need more medicines, more drugs. This is a evergreen sector. The only thing, please remember, this sector will not give you flashy returns in 2-3 years, but will not give you very bad returns over long. It will be a steady state compounding sector and a must have as a core component of a thematic play. Obviously, you'll say, आप biased हो, आपका NFO आ रहा है, but this is how the sector plays itself out. This is how the industry has grown 11% and expected to continue growing from an Indian pharmaceutical space. It's now reached to like 38,000 crores, steady state of 11% growth. This is the sector, or this is the theme where India will likely to gain market share. So what is contract research and manufacturing? Hyderabad is being the big benefactor for the last 20 years because of what?
Pharma city.
A pharma city, but more importantly, more money has come because of Silicon. So what has it captured? It has captured IT outsourcing from the world. So any large companies, IT backend is now being done mostly from Hyderabad. Now it's going into professional services also, GCCs, Deloitte, KPMGs, everyone is opening in Hyderabad, Bangalore, Chennai, Pune. Same thing, now large pharmaceutical companies in the world, to create a new drug, it needs to go through 4 stages. First, you need to research and find a new drug. Let's say to create whatever, cancer. Once you find on drug, you have to take it through 3 phases. Clinical phase 1, phase 2, phase 3, which is the human trial. Now, most of this 1 to 4 stages, large companies in the world, the Pfizers and the Amgens of the world, are now outsourcing to other countries because A, cost of scientists and cost of doing all these trials is cheaper. So we have only a 3.6% market share. This is where we think we can take a lot of growth from North America because talent is getting very costly. China has a 13%, but we only have a 3%. So between North America and Europe is where we think we will grow, and it's already getting reflected that for the next 5 years, we are expected to have the fastest growing market share in this segment. So the 4 themes, one is domestically underpenetrated, exports we are one of the large, medical tourism coupled with CRDMO. So why now? Why now is first and foremost. This is a multi-decadal everlasting theme. Second, remember the slide I showed you? What was the median age India went? Was 28. When US in the 70s went from 27 years, roughly हमारा age अभी जो है, to 37, look at the spend on GDP in healthcare. It went from 9% to 20%. So if India is here, the same thing will start playing because as median age of population is rising, spend will go up. Healthcare spending in US was $98 billion, has gone to 379, 40 times increase in healthcare spending for a 10-15 year difference in age profile. We think India is at the same inflection point which US was in the early 70s and 80s, and with a much larger population and increasing insurance coverage. And given that, if you are to plot the healthcare index of US has outperformed, the healthcare index from 1995, 30 years, has given 8.6 times. The S&P has only gone up by 4.5 times. Our belief is the domestic healthcare index should outperform the broad-based Nifty and Sensex over the next 5, 10, 20 years. I keep repeating, there are multiple themes which are playing in India which are multi-decade. हम लोग सब वॉरेन बुफे का नाम देके ताली मारते हैं ना. You know when Warren Buffett actually started creating wealth? After what age? After 50. So please don't get too impatient and look at ideas which will give you returns in 3 months to 6 months. The second important thing is contribution of pharmaceuticals in India in 2015. 68% of the earnings in pharma and healthcare sector in India was coming from export generics. Like you said, Hyderabad is the pharma hub of the country, and every 1 year you used to hear US FDA has banned this company, banned that company. I used to come and meet a lot of institutional clients in Hyderabad, and I have been actually privy to one instance where I was sitting in the reception and suddenly one team from US lands up. They will come like commandos, huh? Suddenly 2-3 jeeps will come from nowhere and land up. You know where they go first? They will enter the office. What will they inspect first? What is US FDA? FDA basically comes and checks whether your labor policies are in place, whether your drugs and are prepared in the most hygienic manners, whether your office is, all of that they will check. So that the output is when you are putting in a drug is all clean and pristine, you are not doing all fudginess.
Quality control.
Quality control is top notch. So what do they come and, what do they inspect first? Very strange, huh?
Health.
They should go to the lab, no?
Washrooms.